When you should take a pregnancy test? How pregnancy tests work. Think you might be pregnant? Even with the most effective birth control methods, there's always a chance for error. After all, it takes just one sperm to fertilize the egg. Finding out whether or not that's happened is as easy as taking an over-the-counter OT pregnancy test. OT pregnancy test typically tests your urine for a hormone called human chorionic gonadotropin (HCG). HCG is only present if you're pregnant. The hormone is only released if a fertilized egg attaches outside the uterus or to your uterine lining. There are different ways to collect your urine for the test. Depending on the test you choose, you may have to collect your urine in a cup and dip a testing stick into the liquid. Collect your urine in a cup and use an eyedropper to move a small amount of fluid into a special container. Place the testing stick into the area of your expected urine stream so that it will catch your urine midstream. According to Cleveland Clinic, most tests are 99% effective if taken after a missed period. The best part is that you can do it in the privacy of your own home. Simply open the test, follow the instructions, and wait for the recommended amount of time to view the results. After the recommended waiting time has passed, the tests will display your results in one of the following ways: a change in color, a line, a symbol, such as plus or minus, the words pregnant or not pregnant. How soon can you take a pregnancy test? You should wait to take a pregnancy test until the week after your missed period for the most accurate result. If you don't want to wait until you've missed your period, you should wait at least 1 to 2 weeks after you had sex. If you are pregnant, your body needs time to develop detectable levels of HCG. This typically takes 7 to 12 days after successful implantation of an egg. You may receive an inaccurate result if the test is taken too early in your cycle. Here are some signs that you should take a pregnancy test. 1. You've missed your period. One of the first and most reliable signs of pregnancy is a missed period. If you don't track your cycle closely, it might be hard to determine whether or not you're late. Many women have a 28-day menstrual cycle. Consider taking a test if it's been more than a month since your last period. Keep in mind that your period can sometimes be delayed or skipped due to stress, diet, exercise, or certain medical conditions. Also pay attention to your flow if you suspect pregnancy. It's common to experience light bleeding or spotting in the early weeks as the egg buries deeper into the uterine lining during implantation. Take note of any difference in the color, texture, or amount of blood. Contact your doctor if you have bleeding and a positive pregnancy test. 2. You have cramps. Implantation can also produce a feeling similar to menstrual cramps. In early pregnancy, you may feel this discomfort and think your period is just around the corner, but then it never comes. Sound familiar? Take a test. Hormone levels vary by woman and by pregnancy. 3. Your breasts hurt. As your pregnancy produces more and more estrogen and progesterone, these hormones start to make changes in your body to support the baby's growth. Your breasts may feel tender and appear bigger due to increased blood flow. Your nipples might hurt and the veins might look darker under the skin. Because many women also experience breast discomfort in the days leading up to their period, this symptom isn't always indicative of pregnancy. 4. You're feeling different. Along with cramps and sore breasts, early pregnancy can cause nausea, food aversions, exhaustion, frequent urination. As the weeks go on, these symptoms may get stronger before your HCG levels even out late in the first trimester. You know yourself, so pay attention to your body. Any unusual physical symptoms could prompt you to take a pregnancy test.